Okay, part two. I hate my camera. I don't know what's going on with it. Alright, so lower surgery stuff. Okay, so I want to talk about really like the double standard between bio guys and trans guys around lower surgery. You know, the whole thing, like phalloplasty, originated from the fact that there needed to be a solution to men who had really badly damaged penises, accidents, whatever, and so phalloplasty was developed, and that was a solution, and it's kind of widely accepted as, yeah, a guy's gonna use his fucking right arm, whatever he can get to repair his penis or make a penis so he can, feel functional or whatnot. And yeah, is there erotic sensation? I don't know. I mean, if you left with a stump and you take your arm and create a phalloplasty, this is basically the same as a trans guy. But the motivation is the same, is to have your mind match your body. And yet people think it's a really sad thing when trans guys do that. It's like, oh, you're taking something that's perfectly functional and erotic and, and you're changing it to something that maybe isn't. And it's like, I don't think that's the point. The point is that, it's not fully functional. It's not okay. It's not okay. And it's a quality of life issue, feeling whole. And guys, when they develop erectile dysfunction, they get the erectile implants, and they have to really just excavate out all the erectile tissue and left with just the outside skin. And so yeah, I don't even know if they orgasm, I don't know if they have erotic sensation, but once again it goes back to, in order to feel like they really can be congruent with their identity, that they need that. And I think that kind of respect needs to be transferred to trans guys too. It's just like, regardless of what you got beforehand, it's still the route to take. It is a route to take, I go back and forth between the metas and the phallos, all that kind of stuff, and that's a whole other debate. But and I guess I bring this up is because I've told people who are non-trans about it, and they have various feelings. Interestingly, guys totally wrap their head around this, and okay, it's mostly the women who kind of have a hard time with it. So I want to talk about anecdotes with girls that I went on dates on, stuff like that. So there was a girl who came to see me, visit me. She was from out of state, and she and I met via my YouTube channel. We talked for months, so she came in to visit me. She's straight, and I was really nervous. She had never been a trans guy, and I wanted the experience sexually to be seamless between me and the bio guy she's been with. And it's kind of unreasonable, but that's like, trans guys, I think, lofty and get really idealistic, but the idea is that I don't want to be different, and of course it is. And I asked her, what she felt like she had never had experience in what I call my standing cock, and so she had some feedback about that. One of the things she felt is that the experience with it seemed not as exciting or fulfilling, not because of anything on my part, but more of like, she knew that it was one-sided, that I wasn't really getting anything out of it, kind of thing, and that kind of lessened the experience, which is kind of interesting. And I was going to go on a date with this one girl, but then I told her I was trans, and then she said that she just wanted a normal experience, which I kind of can understand that, because it's kind of an inconvenience for me, and apparently it's for others too. And then I went on a date with this one girl who, on paper seemed great, cool, and then I met her in person, and there was something slight abnormal about her face. I don't know if she had some kind of issues or reconstructive stuff done, but I could tell that there was a speech issue there and whatnot. But I was really trying to look in her eyes and just kind of see the person that she probably feels inside, like I do, right? So I don't know, that kind of fucked with my head a little bit, because I didn't feel attracted to her, not just for that, but for personality reasons. But I felt kind of bad. So that kind of made me think a lot. Anyways, so the bottom, I was like, what? I don't need to be dating. I don't need to be having sex. I'm cool. Yeah. So lower surgery, yes. I got to get on that. Yay. that's it.